Provincial governments aren't exactly lining up to thank Federal Finance Minister Jim Flaherty for his take-it-or-leave-it offer on healthcare funding. And yet, Mr. Flaherty is promising to deliver quite a haul to the provinces. Over the next 5 years, as it has for the past 8, the federal healthcare transfer will increase by 6% a year. Ontario will be getting a check from Ottawa worth $11 billion this year. That figure will rise by 6% next year, and another 6% the year after that, and the year after that, and the year after that. And another 6% more the year after that too. But then, and here's where we get our plot twist, 5 years from now, the feds will take a baby step towards cost control. They'll cap growth in healthcare transfers at the level of nominal economic growth. In most years, that should be around 4 or 5%, and Ottawa has even promised that the transfer will never grow by less than 3%. Is this a frontal attack on public health care, as Ontario Finance Minister Dwight Duncan put it last month? Come on. But what's really radical about the Harper government's plan is this. What does Ottawa want in return for its billions? Nothing, apparently. The feds aren't demanding that the provinces launch new programs or abide by any new national standards. Health is, according to the Constitution, an area of provincial responsibility, and the feds appear to actually want to leave healthcare as a matter between the province and its voters. For many provincial governments, that is a terrifying prospect. Take Ontario. Healthcare costs have for years been growing faster than the provincial economy and faster than the ability of the province to pay. Acting as if there's a magic piggy bank in Ottawa only diverts Queen's Park from making hard choices and only fools voters into thinking that no hard choices are necessary. Canada spends 11.4% of gross domestic product on healthcare. That's more than most developed countries. The Australians, for example, spend about 2.5 percentage points less. What does that mean in dollars and cents? It's the difference between Ontario running a $16 billion deficit and running no deficit at all. Provinces should be experimenting with new ways of delivering and managing healthcare to get more bang for our buck. Countries with excellent healthcare systems, Japan, Australia, Norway, the United Kingdom, Sweden, spend much less than we do on healthcare, yet provide a high level of service. What can we learn from them? Some provinces, in this search for the future of healthcare, might even consider raising taxes. It's a viable choice. There's no iron law that says we must spend as little on health as the Swedes or the Australians. Maybe we want to spend more. Our taxes are, believe it or not, relatively low by world standards, so voters can choose that option. In fact, some countries with excellent healthcare systems spend even more than we do. Denmark, the Netherlands, France, and Germany. These too could be models. What we cannot have is the status quo. One of the benefits of federalism is that different provinces are supposed to have the power to do things, well, differently. They're supposed to have room to innovate. The Harper government is giving them a gentle, belated shove in that direction. Will the provinces scream? Of course. Don't listen. Change is healthy. So is responsibility. For The Agenda with Steve Paikin, I'm Tony Keller.